There is corn from a cob versus a corn chip from a bag. The former we consider to be food. The latter is a non-food.
Yeah, except for if it was grown with glyphosate. But look at the ingredients.
This is why that non-food tastes good. This is why you want.
But you get addicted to it. They have addicting things in there.
Hey everybody, it's Dr. Jack.
And Mary.
And this is the Forbidden Doctor Podcast, episode 119, The Hell of Neuropathy.
Ooh.
And that's what it is.
Yeah.
The silent horror. We are just going to finally validate the people that suffer horribly with the pain of neuropathy. We've been asked a number of times to do this, and we pass over it.
We're doing particularly peripheral neuropathy, too.
Yes. So we're going to go after the forbidden knowledge and find the cause of health for this problem.
Not the cause of disease.
No.
We're going to find the cause of health.
Yes, and we're going to dig in and we're going to search and finally get to the root cause, the bottom reason, the foundational reason as to why this is happening to you.
We're not going to tell you in validating ways just to simply stop the symptoms and, you know, what doctors do, just throw drugs at this.
Yes.
We are going to help you with your peripheral.
Well, that sounds good to me.
Yeah.
All right.
Here we go. Okay, this podcast is brought to you by Long Life Energy Enzymes, and we got another killer testimonial on there.
From a verified purchaser, I might add.
Yes.
This is not somebody that just wanted to help us out.
Yeah, we're doing pretty well with these on Amazon. I'm excited. We haven't even advertised or done any kind of Facebook ads or anything. This is just coming in. Beautiful testimonials. They said, we've been taking them for at least 6 months and our overall health is better. Digestion problems have been eliminated.
Oh, good.
So what they said was, if you want to help your body heal, take these enzymes in uppercase. We've been taking them for at least 6 months and our overall health is better. Digestive problems have been eliminated. Heartburn is no longer an issue. And we both have an increase in energy. With this whole food supplement, we know our whole body is being rejuvenated from the inside out. I had recently lost a friend to pancreatic cancer, and one always wonders what else they could have done to prevent it. And when I heard the Stockwell's podcast on these enzymes, they sounded like just what I had been looking for. Listen to their podcast. Great product. Yeah. Great customer service.
I like
and
those things.
One of the reasons I brought this up was also a testimonial a couple podcasts ago, maybe 3 ago, where the 27-year-old guy had a mass on his liver.
Yep.
And what I wanted to point out is the doctor didn't want to do anything. In fact, he said, come back in a year. We'll watch it.
We'll watch it.
So he didn't do anything medically. He didn't take any drugs. He didn't do chemo. He didn't do anything. He just took our Lee enzymes. And the mass vaporized
It's gone.
Vaporized, as he called it. It's on Amazon. If you want to go to Amazon, look at it.
Read it for yourself, yes.
Then here,
what do you know about that?
20, all 5 stars, no 4 stars. And I can't manipulate that. That's just a picture, right? Well, I guess I could.
Well, you put it on the slide, but it's Amazon that publishes that, not us.
Oh, I know.
Yes.
And there we got all 5 stars. I hope it stays that way. That'll be wonderful. And there's 20 really long testimonials. I mean, they're people.
Yeah, they don't say, hey, this is good.
Yeah, loved it.
Yeah.
Yeah, so anyway, I'm really happy with that.
All right.
But our ageless thyroid,
now back in stock.
Yeah, it's been gone for about 3 weeks.
We've had people camping out the front door with their tents and things. When's it coming?
I can't tell you how many people have said, I'm so glad I bought 5 at a time. We had one person buy, wasn't it 7?
Yeah, at least 6.
Yeah.
It may have been 7.
But they're back in stock. We bought 2,000. I don't know. I hope they go fast, but they might go fast.
There's no room in the kitchen anymore, but we have we
in our clinic,
received a shipment of 2,000
But
bottles.
Amazon, of course, yanked these, so they are not available on Amazon because Amazon won't have anything on there that actually heals. No, wait. We have their Long Life Energy Enzymes.
Yeah, that's there.
That's there. That does. And these are only available now on our website, forbiddendoctor.com. And
so either over the counter or forbiddendoctor.com.
Yeah.
Yep.
So enjoy the peace that comes from foundational healing rather than the useless frustrations of managing symptoms. which is what we're going to talk about a little bit in this podcast.
All right.
Okay, our weekly feature, Forbidden Secrets They Don't Want You to Know. These are the secret things they keep from you, the dumb things they tell you, and the really important things they know nothing about. And
this just came out. This was just announced here the other day.
this is one of the things they know nothing about.
Colorectal cancer rates rocketing in millennials. And 5 study insights. Now, the millennials are from 20 to 40 or 20 to 39.
Yeah, our son misses it. He's 17.
He's only
so
17.
20 to 40-year-olds. It's rocketing. And so the article, I'm not going to read the article, but parts of it. After years of decreases, colorectal cancer is re-emerging at an alarming rate in the millennial generation. A study was published in the Journal of the National Cancer Institute and examined colorectal cancer rates between 1974 and 2013. And there's a bunch of stuff they say in here, but what I wanted to pull out is, well, here's one statistic that I was rather scary, so I put it in yellow and red like on fire. But compared with adults born in 1950, and you were born 1950, adults born in 1990 have double the risk of developing colorectal cancer, colon cancer, and quadruple the risk of rectal cancer.
See, now people born in 1990 right now would be 27.
That's the millennials.
Would be 27 if they were born the first half of this year. 27. So those are the millennials. 4 times the risk of rectal cancer. Now, the rate of pediatric cancer, which is up to the age of 21, is now 10,000% higher than it was in 1950.
Yes, become the number one cause of death from disease for children.
Yeah, 10,000% increase.
So, you'd think that they would just be screaming, what happened? How is this happening?
Yeah, where's the outrage?
Yeah, but what Dr. Siegel concluded was that we need an increased awareness.
Yeah.
Awareness. We need to be aware.
You think you wouldn't be aware if you had a tumor growing in your rectum?
Yeah, we had a patient with that.
I went to the bathroom, but it doesn't feel like everything came out.
Yeah,
I'm not trying to be funny here.
No, that's what he complained
ridiculous.
of. He complained of that, and it was so bad. I mean, it was just the most horrible feeling. And it's all gone. His tumor is gone.
Who's his?
That had colorectal cancer.
Who are you referring to?
I'm not going to tell you. It's a patient.
That's what I'm trying to say. It's not in this article.
Oh, no.
Yeah,
this is our
I wanted to make that clear.
Yeah.
I know it's one of our patients.
And he took the long life energy enzymes along with did GAPS and did an incredible change in his diet. I was so proud of him. But he did do some chemo.
Yeah.
Very light chemo to shrink the tumor. And then, bam, got it all out. He did everything, man. He was awesome. He's a rock star. He did enemas. He was just amazing. And I'm sorry we're talking like that, but it would mean a lot to you if it happened to you.
So they finally come along and they say colorectal cancer, if detected early, has a more favorable outcome. Duh.
Yeah, they just say recommend screening more often, but not one word about prevention or healing.
Or why these numbers are happening.
Nothing. That's why I have up there the important things they know nothing about.
Now, we have our opinion as to why this is happening. The massive amounts of electromagnetic radiation that's in our society now. Yesterday, a family came in and they had a little 2-year-old, maybe 3-year-old son.
Teeny little guy.
I was seeing his 6 or 7-year-old brother, but because he had come in with bad headaches because he'd had a soccer collision. A little 6-year-old kid with bad headaches. They're gone. I can honestly say they're gone.
Wow.
But the little brother comes in with headphones and a little iPad, and there's no human contact. The whole time he was in the clinic till the time they left. Now, it kept him quiet, I have to admit that. But he's got headphones on using an iPad that's hooked up to the Wi-Fi.
He's like 2?
He is being bombarded with electromagnetic radiation.
Well,
and all the stuff that's in our foods. And the fact that these kids now, their breakfast is breakfast cereal or no breakfast, Hot Pockets, pizza, French fries, ice cream. They are suffering from massive malnutrition. No wonder they're getting cancer at these ages.
Right, and I think we could handle the EMTs, but if we had good nutrition, I think that's the saddest thing because
Well, number one is the malnutrition.
number one, and then the vaccinations, of course.
All right.
But we're not going to go there on this podcast. We almost did. We had to take out 1 million slides.
Yeah.
Because there's the stuff that's coming down
the latest
from
stuff that's
that
coming
study
down from
or
that study.
pilot
Oh, yes.
study
Oh, yeah.
that said the vaccinated kids are not as healthy. In fact, they're way less
Yeah.
healthy. Anyway, we'll do that.
We'll get to that later.
Okay,
All right.
let's get on to the disclaimer. This website podcast is not intended to be a diversion away from the current system of disease management. It is our intention to offer a rational and very effective approach to aiding your body in its ability to rebuild and heal. Please be advised that any suggested nutritional advice or dietary advice is not intended as a primary treatment or a therapy for any disease or particular bodily symptom. Nutritional counseling, supplement vitamin recommendations, nutritional advice, and the adjunctive schedule of nutrition is provided solely to upgrade the quality of foods in the patient's diet in order to supply good nutrition supporting the physiological and biomechanical processes of the human body.
Here's Paul.
Here's Paul. Got an email from him July 16th, 2016 at 1:17 a.m.
I need help. I have been suffering from severe neuropathy since 2006. Even opiate-based drugs don't help much. Lyrica does help a little, but it costs so much as I don't have good prescription drug coverage. This disease has cost me my career and put a strain on my marriage. Sometimes the only thing I look forward to is death. I want to live to help my wife who has beginning Alzheimer's and for my children. But it's so difficult to cope. I really need some help. I and so many others need a cure to stem this health disaster and possibly reverse it. I have every symptom a person can have that has been diagnosed with peripheral neuropathy. It is so maddening. I don't even know what to say. Sorry for my rambling, but the only thing that helps me is my faith in Jesus Christ and that one day there will be no tears. What do you do when you get a letter like that at 1:15 in the morning?
You know, we hear you. We are listening, and we're going to hit it head on in this podcast.
Yes, we are.
And all I can say is, first, do no harm.
So, all right. So, neuropathy usually shows up in the lower extremities, usually from the knees down to the feet. Here's a couple of nerves that you can see here. The unhealthy one and then the one on the right. If you look closely, they're the axonal part of the body, the long thread-like thing, is a much healthier representation.
Look like little hot dogs.
And yeah,
That almost looks like hot dogs that have been chewed on. The nerves have been chewed on.
Well, that's a good way to put it because there's several things they're chewing on those nerves, and we're going to get to that. But it's damage, it's injury to a nerve or a set of nerves from some disease process and some kind of insult that reduces the proper functioning level of that nerve. And this can affect feeling by either increase or decreasing the sensation. In other words, it can get worse or all of a sudden there's numbness. And for the purposes of this podcast, I want to focus on the most common form of neuropathy that we see, and that is peripheral neuropathy, primarily found, as I said, in the lower extremities from the knees down to the toes. So if you've never had it, you're very lucky. And if this is currently in your life, then you know why we called this podcast the Hell of Neuropathy.
Jeez.
And so unless this condition is caused by a direct blow or a fracture, some serious disease, malnutrition from the standard American diet, or vaccine damage.
Or antibiotic damage,
but we'll get to that. You almost never see a case of this peripheral neuropathy in young people. It's usually showing up in the older people.
Comes on slow.
So.
Ouch. But this is how I've had patients in the clinic that I've worked with talk about this. I've had them cry. I've had tears running down their face saying, Mary, please, please, I can't live like this. They can't even feel their feet. They walk around. They can't feel It's like walking on stilts.
Yes, and in some cases it's like that, and they are using a walker or they're using a cane because they can't trust where their feet are landing. Sometimes they're stepping on a flat surface and they can't feel it.
They don't know, or
something worse.
Or it's something worse. They're walking on thumbtacks. So every person's experience varies depending on their type of neuropathy, but in general, following the most common. Well, that's what's coming up is the most common symptoms of peripheral neuropathy. That's what we're going to get into. So
you get these severe, strange pains in your feet and your legs and your hands and other parts of the body, including these crawling insects feeling that's under your skin. And then balance is difficult when you're walking, getting dressed, getting out of bed, whenever you close your eyes.
Yeah, if you close your eyes, you lose your... balance,
well,
that's you can't feel your feet.
Well, how many times if you get up in the middle of the night to go to the bathroom, you know where you are because you can feel the rug, you can feel the wood, you can feel the stone, you can feel wherever you're walking. But what if you can't feel that?
Yeah.
Then balance becomes very difficult.
Or you feel that walking on thumbtacks, and that's going to throw your balance off too. So
some of the other things, numbness, heavy... a cardboard type feeling, a heavy cement feeling, like your Novocaine has been injected into your feet and legs like you would get from the dentist.
I've had people describe it that way.
Yeah. Then tingling or vibration, like feelings in your feet and hands, pins and needles, that kind of a thing, that kind of a sensation. Electric shocks that start at the bottom of your feet or your foot that shoot up your legs and on almost any other part of the body for that matter. And then bone pain, especially in the feet on walking or standing.
Oh, look at this guy.
This man's hurting.
Yeah, really hurting.
Yeah, and we've seen this. I've seen, like you said, you've seen them when you're dealing with them nutritionally, when I'm dealing with them structurally. Your heart goes out to them because it doesn't stop.
Yeah, and then eventually you get your legs cut off. I mean, eventually it just...
If it combined with diabetes and then the peripheral neuropathy that comes from the diabetic influence.
Then you get gangrene and...
Oh, it's horrible.
Did we pass that slide with...
Nope.
Okay.
So you get the painful muscle spasm and cramps. The skin may become painful or to touch or loss of feeling of touch with the Agent Orange skin rash that shows up.
I haven't seen that. What is that?
It looks orange.
Really?
You get this orange-looking skin rash, the stuff that they would get with Agent Orange in Vietnam.
Oh.
Then you get these burning sensations in your feet and in your hands, and a loss or lessening of sensation for hot or cold. And a lot of people have scalded themselves because of this in bath water.
Wow.
Because they can't feel the temperature. I mean, this is why this is hell.
Oh, here it is. This is... Yeah,
some of the common symptoms of peripheral neuropathy.
The tissue damage where it just literally just eats
You want to go through those?
Well, I can't really read them, but there's a healthy tissue on the left, and this is more...
and over time, it progresses to the right where you have severely diseased tissue.
Loss of sensation and circulation problems result in increased risk of infection, ulcers, and gangrene. Ooh.
So it's a feeling like you're wearing socks when you're not. You feel that compression around the skin.
Oh, that must be irritating.
The feeling you're walking on crumpled socks or stones. Well, imagine that. Feeling like you've stepped on something. You look down to see what you've stepped on, and it's a flat floor, but you feel like there's something under your feet.
And then it progresses to nails.
Yeah, your feet will feel swollen or like they're bigger than they should be. And then you start having difficulty moving your hands or your feet, and you get this feeling of clumsiness, tripping, the foot drop, or dropping things. Because if it's in the upper extremities, you start dropping things. You think you got a firm grip, and boom, all of a sudden it's gone.
Wow.
And then attacks of daily severe exhaustion with a very strange fatigue sensation. And then there are people who have it worse. Yes.
Yeah. This is the more severe cases, problems with not sweating in the lower body, with excessive sweating in the upper body. It also has digestive problems, feeling of fullness, alternating diarrhea / constipation, or urinary problems or overflow incontinence.
Yeah.
and sexual problems because of the nerve damage here, loss of sensation, feeling, and moisture.
Yeah, it affects both men and women, of course. And a tightening of your chest with an increased difficulty in breathing and or swallowing, and uncorrectable vision problems that your ophthalmologist or optometrist can't take care
well,
of.
that's your nerves again. You know, your eyes are part of your brain. They're the nerves.
Oh, yeah.
And this is just a horrible slow death. And they offer nothing but, hey, get checked.
Well, we're going to show you here in a few minutes what they offer.
Okay, we're going to tell a story here.
Yeah, about a patient. And we want to focus on a certain patient who, of course, will remain unnamed, obviously, who represents really, he's kind of in their middle of all the various cases of peripheral neuropathy patients in our clinic. So we will call him Frank.
Frank, there he is.
Yes.
It's not his real picture.
Well, Frank first presented with numbness and tingling in his feet that he said had started coming on slowly over 2 decades earlier following an automobile accident.
Oh.
Yeah, and he was also suffering from headaches and indigestion and insomnia, and he felt the condition in his feet was of the greatest concern because before he had just come into us, it had suddenly taken a turn for the worst. And he obviously wanted to know if we could get rid of his current condition of feeling like his bare feet were full of pins.
Well, with the car accident, what you do should help also. But
oh, yeah.
That's really bad. That's been coming on, he said, 20 years?
Yes. So we asked him if he was taking any medications, as we usually do during an initial consult, and he denied use except for a statin.
No, not a statin.
Yeah.
For his poor nerves? No cholesterol?
Well, just when his body needs a high level of cholesterol, he's taken a statin. Although he had used some others in the past, mostly antibiotics, he was just using a statin. He was taking some synthetic supplements at the same time.
Yeah.
So we talked to him about that.
Yeah.
So we told him that we had no problem addressing his headaches and indigestion and insomnia.
Yeah, that's easy stuff for us.
That's easy stuff to fix. As those conditions, obviously that's easy. But the sensation under his feet would take a while, as his nutrition revealed through the symptom survey that you're looking at right here, that he had a strong dependence on overly processed carbohydrates, especially anything containing table sugar.
Yeah. Now you can do the symptom survey on our website, and it's free, and we have them fill it out when they come in as a patient manually. But you can go to our website and do it for free.
Yes, and not only that, you can have a free 30-minute consult discussing the results of the survey.
Yeah. So just want to mention that.
So, and we went through the list with him as to the most common causes of peripheral neuropathy.
Due to malnutrition.
Yeah. And they're definitely table sugar.
Yeah.
And processed foods, fast food, junk foods, sodas of all types, non-organic vegetables, because of the glyphosate and other problems like that.
I got to pause here.
He eats a lot of fruit because of the sugar sweetness. And I said, were they sprayed with pesticides? I don't know.
I
said, well, are they organic? I don't think so. Well, they were probably sprayed with pesticides.
Look at that guy spraying these fruit trees or something. I mean, Dr. McBride said that your body will literally call the most horrible parasites to try to clean out these glyphosates that you're eating in these fruits and vegetables. And I wonder, it calls in the Lyme disease parasite to try and combat the glyphosates. And so you get diagnosed with Lyme disease, which isn't the case at all, although you are degenerating and all kinds of horrible things are happening in your body. So your body's doing the best it can do, but it could cause neuropathy too.
Yes.
So that's huge.
Another cause that I explained to him were aspect of his diet with a lot of trans fatty acids and any vegetable oils that are exposed to high heat.
Look at that.
And he was just kind of shocked at all the things we were telling him. Like, well, wait a second. I've been eating this for a long time. Yeah, you have.
Yeah, you have.
You have.
These vegetable oils are carcinogenic after they've been heated. The vegetable oils should never be heated. And of course, that's all our French fries and our deep fried stuff in restaurants are cooked with. Now, if those were cooked in lard, or beef tallow. I mean, that would be actually good for you, but of course they're not.
Yes, or peanut oil.
Yeah, or peanut oil.
Yeah, peanut oil, beef tallow, and then animal fats, duck fat, chicken fat.
Yeah, they're very
lamb
strong
fat.
fats. They're saturated. They're not going to break apart. They're
very sturdy fats.
You can heat
in
them
high
up.
temperature.
You can cool them down. You can heat them up. You can cool them down.
There
You
you
can
go.
freeze them. You can cough on them. No, I don't know if you can do that.
Well, when we got through talking to him about all of this, he kind of laughed because he said, there's nothing left for me to eat. And this is a reaction most people have when we discuss any of a huge number of degenerative conditions that exist today, largely because of their dietary choices and the conditions, the diseases, the symptoms, I mean, whatever you want to call them, that disappear, and some quickly, when the diet is changed from what we call non-foods to Mother Nature-made foods. More specifically, I guess I would say, food that came from the plant kingdom or something that ate the plant kingdom. For instance, there is corn from a cob versus a corn chip from a bag. The former we consider to be food. The latter is a non-food.
Yeah, except for if it was grown with glyphosate. But look at the ingredients.
This is why that non-food tastes good. This is why you want
Well, you get addicted to it. They have addicting things in there.
selected corn.
Yeah, well, it doesn't say non-GMO corn.
We'll take a little of that and a little of that.
No,
And
Roundup has been sprayed on
vegetable
this corn.
oil, of course.
Yeah,
And
heated. By the way, these chips are cooked.
Then corn flour, spices, contains mustard. Oh, there's a good thing. And then dextrose, which is sugar, and then sugar, and then onion powder, and then there's MSG.
You missed monosodium glutamate.
Yeah, MSG.
Yeah, MSG. That's what addicts you to these.
And tomato powder, and then color.
They spelled it French. You know,
Color.
it's got the French.
It has some color.
So it's a little.
Modified cornstarch, hydrolyzed protein, which is another form of MSG. And then protein, where they don't tell you where it comes from. And then, of course, disodium inosinate and disodium guanylate and calcium hydroxide.
Yeah.
And we all know how badly we need those things. So this is why we refer to it as a non-food.
Yeah.
Does it fill up your tummy when you eat it? Yeah,
Yeah.
it's designed to do that. It tastes good. I have to admit, I love Fritos.
Yeah.
But when was
Who
the last
doesn't?
time we had them in the house?
Well,
Maybe at a party?
maybe
When we had a bunch
years
of
ago.
Yeah, and a bunch of people. You know, and I'm not telling you can't eat Fritos. I'm just telling you can't eat them every day.
We make this great taco salad with grass-fed beef and everything, but it's been years since we've made it.
Yeah.
And I don't know that we even got Fritos. It seems like we got some other corn.
I think there was some kind of a corn chip that we used as a base for taco salads.
Yeah.
That was a year ago.
We're just informing you.
Yeah. You know, in a way, you know, we're not telling you can't eat ice cream. You just can't eat it every day.
Yeah,
That's all.
Boy, not with peripheral
Yeah.
neuropathy. So.
And so what is it? Well, the medical diagnosis of peripheral neuropathy is usually made when there's numbness and tingling and pins and needles and pain in the feet or the fingers and muscle weakness, usually in the legs. And then you get these changes in skin sensations where there's a sense of pain at the lightest touch. And there might be swelling of the legs as well as discoloration. And I have to tell you right now, I started taking care of this lady from about 40 miles south of here who came in with all this facial pain. And I thought that she might have trigeminal neuralgia.
That's
But
a
it
bad one.
didn't really fit. And it only just hit me now. I'll bet she's had some form of neuropathy. And you know what? You could probably call trigeminal neuralgia a form of neuropathy because she said, I can't put on makeup. If I touch my face, it burns and stings. After 2 corrections by moi, the facial pain is completely gone. Now we're working on her sciatic problem.
Wow.
But the facial pain is completely
then
gone.
it must have been some type of neuropathy.
I wouldn't doubt it. It's because what's important to understand is that these symptoms did not develop overnight. They took years as your body is very resilient and it can put up with a lot of malnutrition before the systemic inflammation takes over. And this is what what neuropathy is. It's a continuing, nonstop inflammation of a nerve or a bundle of nerves. And your body is always trying to repair itself, as Mary, as you're always saying all the time.
Restore and repair.
It's what it's set to do, is to restore and repair. And it's wired to do that very thing. That's its theme. That's its mantra inside of itself.
24/7. It's your best friend.
And this is how we deal with peripheral neuropathy in our clinic. We do what we have to do to stop the inflammation and then speed the repair and the healing of the nerves.
But what do doctors do?
Well, the doctors do what doctors do, and that's to prescribe drugs, because they will not look at the nutritional aspect of this.
Not at all.
It's like, oh, it's too bad. The neuropathy time bomb has gone off in your body, but don't worry, we can control the pain to some degree.
You were just unlucky.
And Neurontin and gabapentin are the two most common drugs I see prescribed to patients when they come to see us. Why do they come to see us? Because they're tired of drugs for everything.
Well, because it doesn't heal anything. And if they go off of them, they still
exactly
have, and the side effects of Lyrica
and Cymbalta. Cymbalta is a depression drug.
I think
but it's an off-label use now, being used for neuropathy because people who have years of neuropathic pain are depressed.
The little butterflies.
Lyrica helps to a certain point because
it's expensive, though.
It's very expensive. Some people are using Lyrica because it gives them some relief. And then the rest of them here, Elavil and Xanax, again, to calm you down, hydrocodone, which is a narcotic pain, and
that'll
hydrocodone.
Constipate you. That's fun.
And then you got that. To deal with. And here's the pharmaceutical. I was going to say something else. Pharmaceutical industry does not create cures; it creates customers. Look at all those pills.
It's really.
I'm sure somebody did that with Photoshop.
Well, here's a really bad. Oh.
Yes. Now,
sorry, it's the next slide, but still, go ahead and explain.
Right.
This.
So whether neuropathy presents as foot and leg pain, or hand and finger pain, or facial, scalp, some form of abdominal, some skin stuff, even things like erectile dysfunction that can be associated with neuropathies, which depends entirely, all these things, on a healthy nervous system.
And if you don't have good circulation.
Well, exactly. Yeah. And these conditions can all be resolved to some extent by dietary changes, but there are exceptions. Crushing, tearing injuries to the body, or the use or past use of fluoroquinolone drugs that you're seeing here. Severe diabetic conditions, exposure to very toxic chemicals can result in permanent nerve dysfunction, destruction. Even with these extreme examples, we found some improvement when the nutritional aspects have been addressed. But I bring up the fluoroquinolone drugs because they can be devastating to the soft tissue structures of the body, to the bones, to the joints,
ligaments,
to ligaments.
Remember the dumb things they don't know anything about.
Yeah, that was a couple of podcasts ago.
Yeah, where the lady was in the neck brace and she had been through 27 surgeries.
Yeah. Her whole body's falling apart.
Yeah, her ligaments were like bursting.
And that is a warning. That's a warning that comes with this stuff, because these antibiotics can only be described as a scorched earth approach to the body.
Yeah.
This class of drugs, according to the FDA, has more emergency room admissions than all the other antibiotics, and that has been so far suggested by the FDA to not be administered to children or athletes because of its adverse neurological effects.
When your Achilles heel bursts.
That's right. You get ruptures of tendons from these drugs, let alone what it's doing to the nerves. So it has merited what is known as a black box warning by the FDA. Now, this is very interesting because a black box is a type of warning that appears as a box or a border around the text. Now, whenever in a hospital, in a clinic, in the ER, in a doctor's office, whenever they have a box or a container of some kind of prescribed medication, there is an insert in there. Mm-hmm. And the insert tells what it's for, where it comes from, and all the reasons in the world why you would never use it. And fluoroquinolones have the black box, a square of black all around the text. And the FDA can require a company to place a boxed warning on the labeling of a prescription drug or in the literature that describes it. And it's the strongest warning that the FDA requires. And it signifies that medical studies indicate that the drug carries a significant risk of serious or even life-threatening adverse effects. Fluoroquinolones have this warning. Now, when I had that root canal, summer of last year, he immediately was going to prescribe a fluoroquinolone.
Unbelievable.
Right there in front of both of us.
And I threw a fit, remember?
You threw a fit.
And the doctor turned his back to me.
He stopped looking at you. He wouldn't even talk to you anymore. And I said, Doc, this is a scorched earth approach. What are you talking about? This will destroy my gut. Yes, but it's better than the alternative.
Oh, burst your tendons, cause neuropathy.
Yeah. I declined.
Yeah.
And I don't intend this podcast to dwell on the effect of some drugs on nerves that can cause symptoms of peripheral neuropathy. However, many of the patients we help with these kinds of symptoms have a history of heavy antibiotic use, of which the worst seem to be the fluoroquinolones. So I had to mention them in this podcast. We certainly understand, of course, that lives have been saved as a result of these drugs, but that isn't the point.
Yeah.
No. Now, back to Frank.
Yeah.
So we started with a spinal correction, and we saw immediate improvement with his complaint of headaches.
Well, because he had that car crash.
Yes.
Yeah.
Yeah, there was spinal injury. And so the indigestion and insomnia improved quickly, but his complaints of peripheral neuropathy took a little longer as he was resistant to getting rid of certain items in his diet. He wanted to keep his breakfast cereal and his mid-morning snack of some kind of muffin. And
muffin looks good.
And he could not imagine that a bowl of ice cream every night before bed could possibly hurt anything. So after his initial improvement, he plateaued. He didn't get any better past the spinal correction, and
his neuropathy didn't get better.
No, because it did to a certain point, but it was still very bothersome and painful because he wouldn't get rid of what he really had to get rid of, and that was sugar in all forms from his diet.
All sugar.
All processed sugars.
No carbs whatsoever.
No carbs except for a few root vegetables in small portions, and his diet then consisted primarily, as you suggested, of meat, fish, dairy, and eggs, with an assortment of whole food vitamin supplements to begin to make up for and recover as you can from years of vitamin, mineral, enzyme, and all other kinds of nutrient
Look at that.
deficiencies.
That's all raw. We remember, if you've heard our podcast, you need to eat your meat and your animal foods as raw as you can, and your vegetables you cook, because you have no enzymes inside of you to digest
That's why when we eat beef, it's rare. It's bloody rare.
We had raw just the other day. We have raw fish, all kinds of things. I think that looks delicious. Some people would absolutely die when they saw that. But this is what we ate for thousands and thousands of years. It kept us so healthy. And take a look at this. Now, who would turn that down?
Yeah, I told you.
This is how Frank got to eat.
Yeah, this is what you eat, Frank.
We had such a conversation with him because he was so into the medical thing that he couldn't imagine that nobody ever has thought that their nutrition actually could get rid of something as devastating as peripheral neuropathy. And it happened, and it can happen. And it was a beautiful thing to watch.
Because as the body is, as you say, is set to restore and repair.
It is.
You just have to give it the raw materials to do it. And drugs are not going to repair a nerve.
Well, they won't do anything. They'll stop the pain. And you,
So if we were going to take care of him, we insisted on this approach, or nothing better would ever happen with his current situation. And he was taking gabapentin, which did give him some relief. Lyrica also helped, but it had side effects that he couldn't put up with. And these certainly were not fixing anything. As when he would stop or skip his medication, the full pain and discomfort of the peripheral neuropathy come back, quickly return. But the wonderful result with this nutritional approach was not only the healing of his nerves in his feet and legs, but weight loss as well. He lost 40 pounds.
That was really cool. And that I had another patient that lost, I think he lost 60 because he got diagnosed with diabetes and he had horrible neuropathy. And he followed the diabetic diet really, really well and completely got better.
Yeah.
He lost 40 or 60 pounds.
Well, Frank's sleep got better. His afternoon nap shortened from a couple of hours to a power nap of 10 to 15 minutes. And in the end, it took a few months, but in the end, almost all of his pain disappeared.
You mean after we finally talked him into changing
after he
his
cleaned
diet.
his diet up.
Yeah.
I said, Frank, you're wasting your money here. You're wasting your money to continue coming in here and seeing me because you're not getting the most inflammatory causing chemical that people eat today, table sugar.
Sugar.
And I said, it's in everything that you're choosing to eat. It's in the muffin. It's in the breakfast cereal. It's in the ice cream. It's everywhere, the foods you're eating. And what that sugar does, it causes inflammation inside the body. And the nerves we're trying to heal and repair are constantly being set on fire by this sugar. When he stopped the sugar, the pain stopped.
Yeah, as McBride says, a never-ending ulcer.
Yep.
Yeah.
And so Frank is
So I got rid of these.
Yeah. Well, he's representative of several other patients we've seen. Now, we're just picking on Frank, but not all of them got his results. Others got better actually in a shorter time, and others who wouldn't follow closely the nutritional program we gave them, would stop at a certain point without a whole lot of improvement.
Because you got them better with the correction. You got Frank better because of the car accident. But, you're always doing these one-hit wonders, and it's just so frustrating because they walk out pain-free and headache-free, and his insomnia was better. But his neuropathy, because it wasn't better. He needed to feed and restore. Sorry.
Yeah, well, it's like just like I said here a moment ago, that these people don't understand or didn't want to understand that sugar is the most inflammatory causing chemical in the body. And at the end of the day, anything that didn't come from an animal or some oil is going to reduce down to sugar. So when we saw patients whose neuropathies came on slowly and gradually worsened until they were almost disabled, and then they would go on a nerve healing diet like GAPS, to be specific, and then greatly reduce their sugar intake to less than 30 grams of carbs a day, those were the ones who had the quickest improvement with the best results. And one more thing I want to add here, patients with neuropathies in conjunction with diabetes, as you brought up several times, also saw quick results, not only with their neuropathic pain, but also their diabetes to the extent they could cut back on their diabetes medications or actually get off them completely.
Yeah. See, and look at this meat. Look at this eggs and meat. There's chicken, salmon, and beef, and then a nice, beautiful salad.
Nice, beautiful green salad.
Beautiful oils on it, not canola oil.
And so this just, it just goes to underscore the basic premise of the forbidden doctor that Mary and I bring to you, that sickness and disease is not caused by germs and viruses or even stress. It's caused by malnutrition. And when we seek to improve the conditions of malnutrition, using drugs, using other kinds of therapies outside of a real dietary concern, we just deepen the divide between the disease and its cure.
Yeah, so see, you can get rid of those drugs up there and replace them with good, wholesome food. Food you've got to search, but food grass-fed and pasture-raised chickens and eggs. And
I know someone out there listening right now is thinking, but did he stay on the drugs? Yeah, he stayed on the drugs while all these things were being introduced, but then he started to taper off of the drugs and realized, you know what? I stopped taking the drug and the pain isn't coming back.
Yeah.
I'm feeling better.
It's amazing how fast we change now or heal, but nerves do take a while. They can take up to, I don't know. The nerves take about 7 years to turn over.
Yeah.
But the inflammation goes away really quickly.
That's the quick thing to do.
So the pain goes away really quickly. But you have to stay on this diet for the rest of your life. This is the way we should eat to keep that away. Now, as I was doing a bunch of research, and Jack and I were researching, we came across other modalities and things that people did for neuropathy. And we're going to show you a couple. They're not foundational. They don't cure anything, but they give you some relief. And maybe you could use these instead of drugs. But here's one.
Yeah, just an ozonator. Ozone, we know ozone will decrease inflammation.
Yeah. And getting more oxygen. A lot of the studies and the articles I read, and I read I didn't read hundreds, but I read them till late in the night.
You read till 2 and 3 in the morning.
I know. I read
that's
so
about the
many
time
things.
I get up to go to the bathroom.
I almost had sympathetic pain from this. I'm like, I'd sat so long that I thought, I'm getting neuropathy. It scared me. But these ozonators, which we talked about with your root canals and my root canal that got taken out, and how he ozonated.
So I didn't have to take any antibiotics whatsoever.
Right, none.
They just serious ozone treatment with the gaping holes in my mouth.
Yeah. And you could drink the ozonated water, get some good oxygen. And if you listen to our antioxidant podcast, you'll realize how important oxygen is in our body by how long you can live without it.
All right.
So that's something that people have used. Obviously, the longevity one is the one we recommend. It's $2,500, but I would just recommend healing.
Well, you can find ozone sources on Amazon and the internet for under $100.
Yeah.
The problem is you cannot adjust the concentration of ozone, and so they limit them to extremely small amounts that are really below therapeutic value. Yeah. If you want to do ozone, you're going to have to spend some bucks, but it can be very effective.
Yeah, this one up on top is $289. We don't know anything about that one, but the longevity one is the one that our Dr. Wall recommended.
The only one we recommend is from Longevity.
Yeah. And then another one, this one isn't, I don't think, as good, but you can manage the symptoms with
it's just a TENS unit.
Yeah.
It's a TENS. And what it does is it sends out an electric signal, and an electric signal interrupts the pain sensation.
Yeah.
It doesn't fix
heal anything.
No.
It says reducing painful symptoms.
Yes.
Just the symptoms. But, I wanted to tell you guys about it. Or you can enjoy the peace that comes from foundational healing.
Yes.
Now, in the next 3 slides, we will show you there's 3 steps, basically. I mean, we could spend hours on each one, but 3 steps to heal your neuropathy on a foundational level. And this is what worked for Frank.
Yes.
The first is
Aha.
a prescription for a NUCCA upper cervical correction.
NUCCA, for those of you who aren't familiar with it, stands for National Upper Cervical Chiropractic Association. We just focus on the atlas, the top bone in the neck. The reason why is because it's not connected to the rest of the spine.
But you don't.
With a disc.
With neuropathy, though, where you're using the word bone, but
we want to relieve the pressure on the nerve.
The nerves,
yes.
Yeah,
chiropractors are often thought of as back crackers and bone doctors and this kind of stuff. No, it's the nerves that we're concerned with.
Yeah.
That is the bulk of our education.
You're more of a nerve doctor than a bone doctor.
Chiropractic is 10 semesters, not some weekend course that you sign up out of Field and Stream magazine.
Penn and Teller
it's 10 semesters.
Yeah.
Medical school is 8 semesters. So, and most of that is functioning on the nerves in the nervous system.
So see how the nerves are
That's how people come in with that head and neck looking like it does on the left from some kind of trauma, some kind of accident, fall, spill, a difficult birth, horses, four-wheelers, cars, rough girlfriends, whatever else. And the picture on the right, and so what we do is we take an X-ray, and so I can ascertain the biomechanics that created that image on the left, so I know how to make the correction. Then we do films when we're done to make sure they look like the one on the right.
So you do pre and post films.
Pre and post films.
X-rays, yeah.
I haven't the slightest idea what to do for a new patient without film. Because what I'm trying to fix, you can't feel.
You can't pop it.
You can't feel it.
Yeah, no twisting.
It's too deep in the structure. You cannot feel a millimeter here or a millimeter there of displacement. You've got to see it on a film and measure it.
Now, Doug Steffen, the national show you're on, the national radio show where you try to, he's always saying, Jack works on the neck. But people, when they hear that, they get those chills like, no, I've had a chiropractor snap my neck before. And
no, we don't do that.
You don't do that. It's very, very light. We'll show you a picture here in a minute. But it's like enough pressure that it takes to dent a soft marshmallow.
That's right. Oh, I like that.
Yeah. And because no neck was ever meant to be snapped.
So it's not just the head and neck that are kind of out of balance. The whole skeleton, as a result of the head and neck being out of balance, will look like the picture on the left. The high shoulder, the low hip, the knocked knees, legs turning in, as you can see
look
there.
at that twist on that left leg.
And you see knee problems there. That's one of the easiest things to resolve with what we do. And then the neuropathy.
The very bottom, you got neuropathy.
You can't start twisting and torsioning the body without damaging or at least negatively affecting a nerve. And you're going to get neuropathic pain as a result. The picture on the right is what you look like after the spine's been brought back into balance. And this happens to so many patients on the very first visit.
Yeah, you one-hit wonder guy.
Yeah, they just they can feel it. They walk around and holy smoke, what happened?
Yeah.
And if there's somebody with them, a spouse, friend, whatever, family or parent, wow, you look different.
Who are you telling me about? Yesterday, you had a patient where she got kickboxed to the point where she went unconscious.
Yeah.
It was like 20 years ago.
Terribly abused, yeah.
Yeah, and she never...
She's been everywhere.
She's been everywhere. Medical,
done everything.
Tons of pain meds.
She came in from a referral of somebody else who was shocked at how much quicker she felt after her first correction. She sends in the person you're talking about.
Yeah.
And she just, the lady yesterday just kept walking around like, what did you do? I don't think you did anything. I could hardly.
Because it is so soft.
Here's a 6-year-old little boy.
This is our grandchild.
It's our grandchild.
And he's smiling and he loves the corrections.
Oh, when his mother or daughter brings him into the clinic, because he's constipated.
Yeah, when he doesn't get his corrections, because he's a super active little boy, and he doesn't get them, and he gets out of correction, his nerve innervation to his bowels doesn't work properly. And as soon as he has a correction...
You got to take him to the bathroom, or you're going to have an emergency.
Yeah, he did that at our house one day after you'd corrected him. But see how he's smiling?
Yeah.
And he loves it. He lays down and smiles, and it's very, very soft touching. I mean, he wouldn't be doing that if you were hurting him.
Oh, no.
So I had another picture of this same correction the same day, and his eyes were closed. But it's very, very soft. So that's number one. We recommend you start with a NUCCA.
Structural correction, yes.
Structural correction, upper cervical. If you can't see Jack, there's many upper cervical doctors. We recommend NUCCA, but there's other really good upper cervical doctors also. So
number two thing we recommend is that your body only needs a few things to set it right and to heal the most delicate of human tissues, your nerves and the myelin sheath. And that sheath that covers the nerve, without which there would be some kind of neuropathy anyway.
Yeah.
And so these foods will nourish and rebuild that marvelous nervous system of yours that keeps you alive.
Now wait, go ahead.
It keeps you balanced, it keeps you dreaming, it keeps you loving and caring for yourself and for others.
You knew we were going to mention gaps.
Oh, yes.
So this is really critical. I just have to, you have to see these pictures. This is bone marrow. Look at this I stole it from mymansbelly.com.
I think you can see the marrow. These are bones, of course. Mm-hmm. And have they been roasted? It looks like they might have been roasted.
It looks so good. So this is the way you get to eat.
In a pot of soup.
And there's a pot of soup, big onion in there, bay leaves, all kinds of rosemary we love putting in these soups. And there's just another picture. And we recommend you go on soup, either bone broth or soup with vegetables in it, for 7 days. Eat nothing else but
this for
soup.
7 days.
And give your digestion a rest. And if you've been on fluoroquinolones or any other massive antibiotic, of course you add in probiotics. And we have a protocol you can get on our website for the gut and psychology syndrome, the GAPS, if you just search for that. Okay, so that's number two. This is a huge subject, but it's so critical you do this. And you will notice the inflammation and the pain going away within days on this. The third step
is you've got to rebuild the nutritional lack that's in your body.
Yeah.
The years of malnutrition have robbed you of vital nutrients, and so they have to be rebuilt.
Yeah, these are really critical supplements, and I just put in I didn't put them all in. There's other, if you go on our website and search neuropathy, there's a few other herbs and a few things that, depending on how severe your neuropathy is, but these are very, very important. The Neuroplex has the protomorphogen for your nerves, so it will stop any autoimmune attack that's happening. It also has nutrition for your nerves. Cataplex E2 will also increase oxygen in your body, so that can help with inflammation. Diaplex, this is the most incredible product. I'm always saying if everybody took 4 Diaplex a day, there would be no health problems in this country. We use it for diabetes, thus the name Diaplex. But the nutrition in this, the whole food, glands and organs in this is just stunning. Then Cataplex B, the best food for your nervous system, of course, is
and that's the entire
vitamins.
B family. You can't just give somebody B4, B1, 2, 3, 6.
Yeah, B6 is one that they
You've got to give them the whole family because it works together as a synergistic unit.
And then evening primrose and wonderful oil. There's other oils I would recommend too, but that one's really critical. St. John's wort and a raw egg shake. The perfect food every day. Maybe I'll include the raw egg shake again on this podcast. I include it like every other podcast. So you're probably sick of it, but it's so critical. And it's got protein and whey and colostrum and all kinds of incredible things in it.
So to recap,
eliminate all processed sugar.
Because this causes inflammation.
Yep. Eat meat, fish, dairy, eggs, and spices for 6 months. Start with broth and soup for 7 days.
And there are plenty of cookbooks out there to show you how to make just delicious meals with what Mary just said to use.
Just type GAPS recipes in the internet. And
just delicious meals.
Yeah. And then get a good upper cervical chiropractic care for a better nerve function.
Yes.
Be patient. Nerves do heal, but they heal slowly, but the inflammation should go away really quickly.
Yes.
If you don't cheat and eat the number 1, eliminate all processed sugar.
I'm feeling a lot better. I'm sure I could have a nice big bowl of a quart of ice cream.
That's why I have poison.
You're going to wake up in hell the next morning.
I have poison over there. Yep. And then stay on the neuropathy. Did I spell that right? Neuropathy protocol until a significant reduction of symptoms occur.
Yes.
Okay. That's a recap. It's beautiful, but I'm telling you, the next slide is something really special.
We are so excited about this.
Yeah, we have a really big announcement.
We are so excited to give a hint of what's to come. We have produced over 100 podcasts. We spend hours and hours, as you might imagine, producing these presentations. And we get letters as a result from all over the planet. Now, we're still working on our first 1 million downloads. We're close.
Well, yeah, it's amazing how many people love these.
And while we're doing these podcasts, we always want to put more into them than, frankly, time allows, because this podcast right now is at 55 minutes. And so even though these podcasts are usually an hour long, we feel like we just skim the surface of each subject.
Like today.
Yeah, like today.
Yeah.
Because we could have gone into this a lot further. But that's where true healing comes from, education and the application of that education.
With steps and hand-holding and questions and answers.
Yes.
We want to bring you into our kitchen, into our clinic, into our mind and our hearts, and really offer you foundational healing.
So we are in the process of producing webinars to further your interest in education concerning the forbidden doctor
inside of you.
Yes.
Inside of you, we're going to bring it out. So there'll be several parts that so we don't miss a trick or a fact or any concern you might have. It's going to be, we don't know. It depends on the subject. Could it be 2 parts, 5 parts, 2 weeks long? We don't know. We do know, but it's different for every single.
But the important change from a podcast is we're going to be doing them live, so we can answer your questions during the live webinar.
Yeah,
it's something you have to register for, but we're not ready to register yet.
Yeah.
So, and we hope to have the first one up and running in the next couple of months.
Yeah, coming soon. So stay tuned.
They're coming soon, only at the Forbidden Doctor.
Yes. And here's our disclaimer. The statements made in this webinar about specific products have not been evaluated by the United States Food and Drug Administration, and are not intended to diagnose, cure, treat, or prevent disease. All information provided or any information contained on or in any product label or packaging or this podcast, it's not a webinar yet, is for informational purposes only and is not intended as a substitute for advice from your physician or other healthcare professional. So thank you for listening to these Forbidden Secrets at the Forbidden Doctor podcast. And if you like what we're doing in these podcasts, there's several ways to support us. You can leave a positive review on iTunes or wherever you listen, ask us questions and give feedback and comments from numerous places on our website, or even join our family by filling out a symptom survey.
And again, please leave us a comment or question at the end of this podcast.
Yeah. Thank you for listening to this Forbidden Information. Join us next week for another in-depth discussion of forbidden knowledge.
We'll see you then.
Thank you for listening to the Forbidden Doctor podcast. If you are curious about long life energy enzymes or ageless thyroid, you can purchase them without a membership from our website at forbiddendoctor.com, or get our enzyme formula from amazon.com by searching the full term Long Life Energy Enzymes. Don't forget to take our obligation-free symptom survey to get a free personalized supplement protocol recommended for you by Dr. Jack, Mary, or one of our qualified nutritionists. Take the survey, get a call from our nutritionist to create a protocol and a patient login, then use that login to see your own personal protocol along with any favorites you've saved from our symptom library. Remember, our website and our clinic are here for you always.